My name is Makayla Dulac, and I'm going to be doing tests on the elbow, wrist, and fingers. The first test we are starting off with is the valgus stress test. In the valgus stress test, we're going to start the patient in a 0-degree angle, and we are going to push from the valgus side inward. And then now we are going to do the same thing, except at 30-degree angles. The next and for here we're testing for pain, laxity, and a normal endpoint. The muscle we are testing for is the medial collateral ligament. Moving on, the next test that we're doing is the vagus stress test. This test is very similar to the previous test that I just did, except we are pushing from the vagus side, stabilizing at the wrist, and we push out at 0-degree angles, and then at 30-degree angle, push out. And for this, we are looking for same thing, pain, laxity, and a normal endpoint. And the muscle that we're looking for, or that is sprained, is a lateral collateral ligament. Next test is wrist extension. For this test, what we have to do is we have to, can we put our arm like this so he's up? Okay. For this, we are going to, since it's wrist extension, we are going to start in flexion. So what we're going to have our patient do is push down. Now don't let me push you up. Okay, so after that, I'm looking for, again, pain, laxity, I would grade her a 5 because she can resist against gravity and my force. And the muscle that is connected to this is sprain and extensor carpi ulnaris. And the next test that we're going to be doing is the wrist flexion. So now we're going to start an extension. So I'm going to stabilize at the wrist and push up. Now don't let me push you down. In this test, same thing, we're looking for pain, laxity, and I would grade her a 5 once again because she can withstand gravity and my force. The muscle that we are using or testing for, one of the muscles that we're testing for is a flexor carpi radialis. Moving on to the next test. The next test that we're going to be doing is ulnar deviation. For this, we are going to start her in radial deviation. So we're going to start this way. And I need you to push first. Now, don't push. Now, don't let me push you. Yeah. So hold it. Okay. And for this, I'm testing for same thing, pain, laxity. I would again grade her a 5 because she can withstand my force and gravity. And the muscle that we are testing for is flexor carpi ulnaris. Yeah, ulnars. Ulnars. And then, now moving on to the next test, which is radial deviation. Radial deviation, we would start in the opposite, which is ulnar. So, start this way. Now, please move that way. Now, hold yourself in this position while I push you. Okay. Again, we're looking for pain, laxity, and I would grade her a 5 again because she can withstand gravity and my force. And the muscle that we're testing for or looking for that might be sprained or anything like that is extensor carpi radialis. And then the next test that we're going to be doing is the forearm pronation. So for pronation, again, we would start in the opposite, which is supination. So we would start like this. And I need you to push your palm of the hand down like this. Go. Now, don't let me push you up. Okay, so again, looking for pain and laxity or any non-stability or whatever. And again, I would grade her a 5 because she can withstand gravity and my force. And the muscle we are looking for, this is pronar teres, And yeah, the next test that we're going to be doing is supination. Forearm supination. And this test we're going to be looking for is, we had to start in the opposite again, so we're going to start in pronation. We're going to start pronation. And now I need you to push your palm up like this. Go. Okay, now stay in this position. I'm going to try to push you down. Ready? And again, looking for pain or laxity or anything like that. And we would be also looking for I would grade her a 5 because she can withstand the force of gravity and my force. And the muscle that we were looking for that it might be sprained or injured in some way is supinator. Next test, opposition. Okay, for this test, we're testing the fingers and stuff. So for this test, what I'm going to ask you to do is touch your thumb to each one of your fingers. Okay, good. Now I need you to touch your thumb to your index finger. And don't let me pull you. Okay, now touch this one to that one.